My name is Andrea Piccarelli. I am the marketing manager and the supervisor for IDS, which is the company who developed Blank One. And I am the supervisor also of the Blank One project. For those of you who don't know what it is Blank One is a novel teeth whitening system based on an innovative technology. It's a photochemical technology that has allowed us to develop very fast in-office treatments that are very effective using low concentration of hydrogen peroxide. Basically, we work with carbamide peroxide 16%, which is less than 6% hydrogen peroxide equivalent, and without need to apply gum protection. And this allowed us to create also a light version, a fast version of our treatments in office that is Blank One Click, that has been designed to work in combination right after dental hygiene. And from this idea, we are creating, starting from Italy, where IDS is based, and now spreading all over Europe and the rest of the world. We have created a new approach to teeth whitening. We have created an entry level to the teeth whitening system, which is Blank One Click. Blank One Click can be performed in just 10 minutes right after dental hygiene, and providing a really higher value to the whole section. And this is the reason why we are here today. Last year, we had the pleasure to meet Celso and to introduce our system to him. Celso da Costa is, first of all, he is a dental hygienist, of course. He is the prophylaxis manager for a big group of clinic in dental clinic in Switzerland, Adent, and he's also a trainer and an ambassador for EMS. EMS is, many of you know for sure, is a global brand for prophylaxis. I like to say the Ferrari of prophylaxis, and he fell in love with our system because was perfectly matching with the GBT, which is the guided biofilm therapy, which is the protocol for prophylaxis that EMS is bringing around the world. What I like most of GBT, and what probably Chelsea like more about Blank One Click, is that we both share a minimally invasive approach and a very careful attention for the patient comfort, and this has been a real key in both of our success, I think. I don't want to spend more words myself, because we have Chelsea here with us. So I would like to give the words and the presentation in his hands. Thank you, Chelsea.
Yeah, thank you, Andrea. That's a really good, nice introduction, because that's the goal. That's the goal, to have the minimal invasive treatment as possible. And the interaction in between these two techniques is being the more comfortable for the patient, the less invasive, and just be the best professional that we can be and not damage the teeth. So today I'm going to talk about the future of prophylaxis. Like Andrea said, I'm mixing the two techniques, the GBT and the click, to provide a good result for my patients, but also to provide the minimal invasive treatment. And why to interact these two techniques? Because to have a really good result in whitening, we need to start with the basis, and the basis is prophylaxis. We have to get a good foundation, a clean one, to expect the best result as possible with Click. Andrea already talked about the. I'm just gonna share my screen again, because Andrea already talked about me, presented myself. Well, first of all, I'm a dental hygienist, and that got his formation in Portugal in 2010. And in 2017, I became the prophylaxis manager for Adon Clinics Dentaire. So it's a group of dental clinics. It be part of EDG. It's an European dental group. We have 23 clinics in Switzerland. And we start getting the prophylaxis in the center of every treatment in our clinics. I'm also a SDA trainer for EMS. So, and the goal today is how to get good results with the click, with the blank one click. And for that, we're gonna start with the prophylaxis with GBT. What is GBT? GBT is a minimal invasive technique. Before, we all used the old recipe. We all start with hand instruments or scaling with piezo, and then we got to the polish with the polish paste and the polish brush. But let's be honest, we are getting too much abrasion to the teeth, a lot of pressure, sometimes touching with the hand instruments places that we don't need to touch, removing biofilm with something more abrasive that we need. And the polish brush, it didn't go polish in between the teeth, didn't go polish under the gums. And if we have brackets like this image in the right side, you can see that we cannot obtain the best treatment at the end. We had some years ago Axelson and Lind that start the study. This study had 257 patients, and they followed these 257 patients during 30 years. What they were doing the disclosure every time. So they were doing prophylaxis guided by this disclosure. And following these 30 years, they noticed that the patients didn't get any more caries and no attachment loss. So they were the fathers of prophylaxis, and they were finding something big, something that if we get the right kind of prophylaxis, really meticulous, guided by the disclosure to know where to work and why we are working there, it's going to be the best for the patient. So if we compare the three techniques, the old recipe, the Axelson, Lind, and the GBT, we see that with Axelson and GBT, we do the disclosure every single time. We motivate the patients every single time based on the disclosure. This means that we are seeing the areas that have problems, that the patient cannot clean as it should at home. So we're going to guide them and giving the best advices to improve the oral hygiene. We are removing the biofilm really meticulous because we are seeing it. Let's be honest, the thing that we don't see, mostly the biofilm, that is a soft plaque, we don't feel it. So we're going to be more abrasive and remove some enamel in the process. We are now with new and minimal invasive technologies that we use for GBT, that Axelson and Lind that didn't have access because the technology wasn't available, and more comfortable for the patient because we are using some new materials that are less abrasive, that are softer, and they are smart, that we're going to see in the next slides. Sorry. Okay. So GBT is an 8-step protocol. We start with the access, where we're gonna talk about all these steps more in detail. Then we do the disclosure. After the disclosure, we can see the biofilm, so we can motivate the patient better and with the personalized advice for each one. We start with the airflow. Why? Because we're gonna remove the biofilm, stains, and young calculus. Then we can use PerioFlow for periodontal patients or patients that have some dental implants. We go to the Piezon PS. This is a really thin insert that go till 10 millimeters, and we're gonna only use it in the areas that we have art calculus. We're gonna check. If we see that we miss something, we can revisit. Otherwise, it's good, and you can fix the recall with the patient. The 5 golden rules of GBT is every single time make biofilm visible for us, but also for the patient. We start by using the airflow. First, we use the PS instrument in 95% of the cases. We do not repolish, no rubber cups, no prophy paste, and we are using less power and hand instruments as possible. So we are not over-instrumentating the patient. GBT step by step. So first step is the assessment. The assessments, we are talking with the patient, we are doing the anamnesis, we are doing the screening. Really, really important here in this part, we need to ask the patient what they are expecting from us too. And this is one of the parts that normally if the patient are looking for some more aesthetical treatment, I can talk about the click, the blank one click, and just saying here we have a solution. It's less invasive. It's really in the plan of GBT, the less invasive as possible, comfortable for the patient, is pretty fast and with durable results. And then we can see with the patient what is the color, what we can obtain. But we're going to talk about this a little bit more further. So the assessment is really important. To screening, seeing if we don't have any periodontal pockets. If you have periodontal pockets, we have to start a periodontal plan treatment, of course, because if we have a pocket of 9 millimeters, we're not going to use the whitening treatment. First, we're going to resolve the problem. Then once we obtain a good periodontal health, we can start thinking about static treatments. Second thing, and maybe one of the most important things in this protocol is the disclosure. We apply the biofilm disclosure, then do not say to the patient to spit. No, we're gonna rinse and we're gonna have the aspiration, and the water syringe to rinse directly in the mouth of the patient. And then we're going to obtain this kind of results. Really, really important. I think most of us know the disclosure. We used it when we were at school. It's been around since 1914, but the truth is only 10% of us dental professionals are using it. In this image, you can see on the left and on the right. On the left, we can see a little bit of the biofilm, but once you use the disclosure, you see a lot more. And if you see a lot more, and it was hard for us as a dental professional to see it in the left side picture, imagine for the patient. We are talking about biofilm, we are talking about calculus, but if the patient don't see it, it doesn't believe it. Once you use the disclosure, the patient gonna say, okay, it's not a myth, I have something in my mouth that I need to remove. This is biofilm, and I know the areas that I have to work a little bit more at home. I know some of you are gonna say, yeah, but the most of the disclosures that we have in the market, they are liquids, is gel, is messy, we can get all over the place. Well, you have here one example of the disclosure from EMS. It's just a pellet that you get some tweezers, you get a pellet, and in less than 30 seconds, you get it all over the mouth. I have a video later that I'm gonna show you how easy it is to use it. So third step, just motivate the patient. This motivation is really important. Now that we have the disclosure in the mouth, we can show the patient how to properly brush, how to use interdental brushes. And each time that you use the interdental brushes, you can show him that the right size, and every time you pass it, you remove a little bit of the disclosure. So it's really important to maintain the good health of the patient, the good oral health of the patient, but also if you are doing a whitening treatment, it's a great way to motivate the patient so it can last as long as possible. Fourth step, airflow. The airflow, we're gonna use the plus powder in 90% of the cases. We can use it in supra and subgingival till 4 millimeters with the airflow. If we talk about periflow, we can go a lot more. In 10% of the cases with the hard stains, difficult to remove, we can use the airflow powder classic. But if you use the classic, don't forget to use the plus afterwards, because it's a thinner powder, so it can get it's more efficient. Once you remove the disclosure, you have removed the biofilm, so you can stop. There's no overtreat. You are using the airflow. Once is no more disclosure, you can stop. You have removed everything. The airflow gonna use for biofilm stains and early calculus removal. Really important, you have the powder jet in the middle, and then the water that's gonna involve the powder, just to not get too much aerosols and to not disperse the powder, to guide it. One other important fact is to get the more efficient treatment with airflow. Do not glue the insert, the airflow against the enamel. No, you have to space it in between 3 to 5 millimeters distance. Why? As you see by the graphic here on the right side, there's a acceleration curve. So if you see that it needs 2 millimeters to get the top speed, so to be the most efficient. So get 3 to 5 millimeters distance with the enamel to be the more efficient as possible. Do not forget to have an angle of less than 60 degrees. Why? As you see in the right image, because you're gonna hit the enamel with the powder and water gonna clean it and remove it, so the second wave of powder can also have the optimal contact with the enamel. If you do it like the left side, is more invasive because you only get powder against the enamel. The water cannot remove it, so it's not efficient. You not have an optimal contact with the enamel. So important, 3 to 5 millimeters of distance, and the angulation less than 60 degrees to have a good water cleaning and to have an optimal contact in between the powder and the enamel. Some of you are gonna ask me, okay, can I use the handy or from EMS for the powder plus? You can, but it's not as good as the airflow prophylaxis master. Why? Because you're gonna consume a lot more powder. The powder regularity is not the same. If you have the chamber that is full with powder, you're gonna get more powder out. If it's half empty, you're gonna have less. And with the airflow prophylaxis master, is constant. It's always the same amount of powder. Pressure and water precision, it depends of the unit. If you are using a handy, warm water, the same thing. It depends of the unit. If you have a dental chair that's gonna eat water, you're gonna be eating. Otherwise, it doesn't. The maintenance is really simple with the airflow prophylaxis master to cleaning at the end of the day, but also to remove the powder chamber. And the ergonomics too, because the airflow prophylaxis master is a lot lighter than the handy. The handy is 175 grams, So at the end of the day, you're gonna feel it. If you have done 8 to 10 patients, you're gonna feel your hands a lot more tight. The plus powder is made by erythritol. Essentially, is a natural sugar with low glycemic index. Is totally fine for diabetics. It naturally fights oral biofilm, so it's an antibacterial natural one. So it's good for the patient, and it's all natural. It's soluble, no problem for the lungs, nothing, because it's soluble 100%, and you can find it in some fruits like melon, grapes, or even in mushrooms. So it's completely natural. It's a multitasker. That's why we are using in 90% of the cases. Honestly, maybe I'm using in 98% of my cases. It's efficient, supragingival, minimal invasive, so you can use it subgingival with the airflow till 4 millimeters. In dentin, even in restorations, we're gonna see it how abrasive it is. Optimal, it provides optimal access to brackets around implants, in pits and fissures, and even in interdental. It's really comfortable, so you can use it in primary teeth, but also in the soft tissues like tongue, palates, gums, with no problem. And optimal preparation for restorations, but the most important in this in today's presentation, before bleaching for the whitening. So we have some studies that shows the action in the enamel, but also in some restorations materials. Here in the top image, you can see 5 seconds of air polish with the plus in the enamel. It doesn't do anything. With the airflow, is pretty good too. But once you get for the restorations, here we have glass ionomer. It doesn't get any damage at all with the plus, so you can use it all the way, but avoid the classic, because it's a little bit abrasive in this kind of restorations. So the plus is the way to go. You can use it everywhere. It's minimal invasive. Use the correct distance and angulation and movement, because you don't want to stop in the same area. You have to move the airflow to get the most efficient results. Use the biofilm disclosure. Once you remove the disclosure, you have removed the biofilm, and get the proper irrigation. So this is really nice image. You can see on the left, before the clinic, the residual biofilm. We have the natural structure of the enamel with some depressions, but you can see the biofilm. In the middle one, some of you are gonna say, okay, but I'm using the polish paste and then I'm going for the whitening. So this is a really good image for them, because you have just a low abrasive paste that's gonna remove a little bit of enamel, but at the same time, you see the depression, they are not apparent now. Why? Because they are all covered up with the low abrasive polish paste. So the thing is, if you are using the whitening after a polish with a polish paste, you don't have the optimal contact in between the product and the enamel. You're gonna have the contact in between product and prophy paste. That's why the results, they are not the best with prophy paste. That's why we are using airflow plus powder, like you see on the right side of the image, that you maintain the natural structure of the enamel. There's no biofilm, there's no powder in the depression. It's all clean. So here, after the airflow, you're gonna say, I have the optimal contact in between the enamel and the whitening product. Then I'm not going to be long in the periflow. Periflow is mostly for the periodontal patients and patients that have implants, that we need to really have a good cleaning around it. There are some contraindications. We're not going to use it in a tooth that is right next to earliest extraction that have been done in 2-3 days. If we have a fractured root, for example, a lot of bleeding. So this you need to mix it up with the X-rays to see if there's any problem. If it isn't, you can use it. It is pretty easy to use. Yeah, in the beginning, you have a little bit more difficult because we are not used to. But then the tip is right flexible, so you can use it for subgingival till 9 millimeters in the furcations, root furcations, and around the implants. Just be careful, always using plus powder for the perioflow, slow movements, and be careful with the contraindications, like I said before. So then we're going to use the piezo PS. Piezo PS we can use in 95% of the cases. If you have some problems with distal sides or furcations, you can use the PSL and PSR that you can go till 8 millimeters. And you have the PI is a tip cover in plastic that you can use in restorations and implants that can go till 4 millimeters to remove the calculus. This is for removing the hard calculus because we have already removed the biofilm, early calculus, and stain with the airflow. Like I said, 95% of the cases we're going to use the PS. Like I said, you can see in the top image on the left corner, supra and subgingival. You can use around the brackets, but be careful, do not touch the brackets with the tip. For the primary teeth, you can use it also, but you can use also the PI instrument. Why? Because some of the kids normally they are a little bit afraid. So with the PI, we're gonna read us get less noise. So sometimes it's better for them. That's why. Then the PI you're gonna use in restorations. It does not scratch the restoration, veneers, or crowns. You can use around the implants, the neck. This is really important. Don't go beyond the threads. Use the perioflow if you need to go beyond the threads. Otherwise, you use the PI for the neck of the implant. And then you have the PSR and the PSL till 8 millimeters to the molars, furcations, and difficult areas. And you have the A-tip for really heavy calculus if you need it. We're gonna do the final check for remaining biofilm and calculus. If you see something that is still there, you can revisit with the PS or the airflow. We're gonna now be able to diagnose if there's caries or not, and we can protect. Why I'm saying now we can diagnose, you can see on the left image, it was really hard to see any cavities because there's a lot of stains. And then on the right image, you can see that interproximal, there are cavities for this patient. So that's one of the things that we have improved in add-on. Every treatment starts with prophylaxis, so the dentist can do a really good checkup. And yeah, we have a good oral hygiene also because we have motivated the patients. And then we can fix the recall. It's a no pain treatment, so the patients, they are really happy at the end of the appointment. I'm just gonna show you a little video about GBT, how easy it is to use GBT. We had the palette with the tweezers that we pass really fast. Then we are using the airflow, keep it the movement, the angulation, and the distance of 3 to 5 millimeters. And you can see it's really fast to remove all these stains. And once you remove the biofilm and the stains, you can see the calculus, the hard calculus. Now they are visible. They are easy to see. And if they are visible, we're gonna use the the piezo, only in these places where we need to. So we're gonna avoid overtreat the patient. We're gonna avoid getting so much abrasion to the enamel. And this, like I said, is really easy to use and really great for the patient. Great tool for motivation, a great tool to show them the areas that they need to work a little bit more. So where I use the click now in this protocol, normally I talk about in the assessment, because this is the moment that we are asking the patients for health problems, but we are asking the patients to about their expectations of the treatment, what they want to get as a result. But also it's the step that we're gonna assess, we're gonna see if there's fractures, if there's periodontal disease, and we can see the color of the teeth too. And if we think that we can improve the aesthetics, and the aesthetics, it's part of the health definition from a World Health Organization, is a good state of physical but mentally too, and this can improve this kind of mental health for the patients. And just getting 2-3 shades lighter can be a really motivated aspect in the life of someone. So we can talk about it in the assessment, and then once we get to the step 7, checking up if there's calculus or not. If there's not, we can go to the click, because it takes only 10 minutes. So in the assessment, what are the needs of the patient? They need to improve the aesthetic aspects. They want a no pain treatment. They want an aesthetic treatment that's gonna last in time. They want a fast treatment too. They want something that is not expensive, and the click is something that can provide all these aspects. We can improve the aesthetics. There's no pain in the click. It's gonna last quite normally 4 to 6 months in my patients. I'm gonna show you some examples. It's fast to treat. It's only 10 minutes in the chair. We can count 15 minutes because we need to apply the products, and then the patient stay with the light for 10 minutes. And it's not expensive. We are charging 89 francs for the click in Switzerland. It's a photochemical reaction. So there's some photosensitizers that's gonna accelerate the process. We have a blue light with a wave in between 430 and 490 that the photosensitizers are specific for this kind of wavelength. And we're gonna accelerate the process with this light. And we have the catalyzers we're gonna just decompose these catalyzers till we have the single oxygen. That's the thing that we need to make the whitening. It's 2 syringes that we're gonna mix at the beginning with the photo booster. The name says it all, is the photosensitizers that we're gonna mix with the catalyzers, so we can have the good aspect and the good mixed to apply in the patient teeth. So it's easy and an immediate process. It's only 16% of carbamide peroxide. We can use right after the hygiene consultation. We don't need, as Andrea said at the beginning in the introduction, we don't need any gum protection. It's a low price. It's only a cycle of 10 minutes with the Arcos lamp. Here we have the 2 syringes that we mix, and in the right corner we have a result of a patient that came for a cleaning. We talk about the possibility of do a click that you're gonna get 2-3 shades lighter. This is one of my first patients, by the way, at the beginning of 2019. And you can see with the GBT and then with the click, we improve a lot the smile of this patient. And you can see some gum recessions. There's no problem for gum recessions because it's a non-invasive product that we don't have any sensitivity afterwards. And funny story, when I first used the click, the GBT, I tested with one of my dental assistants. She always wanted to do a whitening, but she had a lot of recessions, a lot of sensitivity, so it wasn't possible. so I said, okay, Andrea, we're gonna test with one of my my dental assistants that's always wanted to do, but she suffered a lot because Blank One was saying there's no pain in my treatment, and I was a little bit skeptic. So I've used it with this dental assistant, no pain at all. I was impressed because that showed that is a less invasive treatment that can use with a lot of patients that never have done the whitening, or they start doing a whitening but they didn't finish because it was really painful. And now I can advise them to use the click because it's fast, it's cheap, and it's natural. You can see in this smile, it's natural at the end of the appointment. Beware of the limitations. Young patients, I don't do any young patients less than 18 years old. I don't do it. Suspicious patients, the patient, they are a little bit apprehensive at the beginning. So some of the patients that they are apprehensive, I show them the results. I don't do at the first appointment, but I'm gonna build the trust with the patients, and maybe I'm gonna do it in the second appointment, 6 months after. So with these suspicious patients, it's better to win them over the time, and then they're gonna be our best best friends, because they're gonna refer a lot of people for this kind of treatment. Periodontal patients, before you need to treat the periodontal disease, and then we can do the aesthetics treatments. Patients that have some prosthesis, patients that have some prosthesis or presence of reconstructions. Here on the left side, we can see one of these patients that had two big restorations in the incisors. It was hard. They always wanted to do a bleaching. They wanted to change these composites too. So I said, yeah, we can try the click. We're gonna have good results, in my opinion. And then you want to change this composite, so you can change with the same color that we're gonna obtain with the click. That was the case. This was at the beginning in the top image. Then at the end, after the click, the patient was really happy, and we refer this patient for the dentist to change the composite. Once again, it wasn't me that was saying, you need to remove this composite. No, it was the patient that wanted to do it. So this is our discussion at the beginning of the appointment with the assessment. And I found an opportunity saying, okay, we have some that is not really invasive, that we can try it. And if you are happy, we can change after the composite for the same color. And the patient is really happy. We have some photos of the end of the treatment that I didn't put it here, but you can see it in my Instagram with the results after the composite. Presence of endodontic treatments, patients with endodontics, they need also internal bleaching. Reduction of the available time. This means sometimes I don't have time to do it in the same appointment. What I am doing is, if I have time, I can do it right away at the end of the appointment. If I don't have time, I can get the patient in 1 second room where I'm gonna just apply the product and leave him for 10 minutes. It's a non-invasive treatment, so you can let the patient stay 10 minutes watching the phone with the light in their mouth. Reduction economic availability here, like I said, is a low price treatment that we can do for our patients. So the outcome is not predictable. We have 3 different patients here. On the left pictures, it's the normal outcome in the click. This patient had 35 years old. At the beginning, she was really happy with the results. At the middle, we have a man with 54 years old. We use the click. You can see, yeah, it's a little bit light, more whitening, but it wasn't the result that the patient wanted. But we had talked about it this in the beginning, saying, okay, your teeth, they're a little bit more orange, so it's going to be a little bit more difficult to change the color. We can start with a click, see the results. We obtain these results, and then I said, if you want more, we can use the home bleaching. That blank one can have it too. We have done some whitening trays, and the patient have done 1 more week at home. I don't have the final result. Why? Because we have the COVID situation. This was right before the COVID situation. So I'm thinking in May I'm gonna have the final result. But I talked with the patient in the phone, and he's really happy. He said that it's way whiter than before. So this is one of the things that you can use the click. You can use the click as a first step for the whitening. Just explain the patient that maybe we cannot predict the results, but we're gonna have some lighter shades, and then we can always improve with other products like this home bleaching at home. On the right corner, yeah, that is an impressive result. I didn't expect to obtain this much of a result, but yeah, it was yellow color, so it was easier to obtain a good result, and the patient was pretty happy. And this patient alone sent me 10 other patients. She sent me all the family because they were having a wedding in 2 months, so that she sent me all the family to do prophylaxis and with GBT and the click. It was great, and the bride have done the touch. So she wanted a little bit more of a white smile. So the efficiency, it's gonna depends of the product that we're gonna choose. Like you saw before with the middle patient, we start with the click, but then we choose to change for the home bleaching. It's gonna be more time in the mouth. We're gonna keep doing it for 1 till 2 weeks, so you can expect a better result. It's in relation to each patient. If we have a base color that is really dark, it's going to be difficult to lighten up. Don't forget that A colors whiten better than D colors, and always look for the shade. If you have a yellow or a white teeth shade, this is the two kinds of teeth that you're gonna white even better. If you have a gray or orange shade, it's gonna be more difficult. And for the C and D shades, you can start with the click and then move on for the home bleaching, or start directly with the home bleaching. So who's the best candidate for a click? I think everybody is a good candidate. Even with restorations, you can see we can use in the treatment plan when we're gonna start with the whitening, and then they're gonna change the restorations. With people that only want a natural, they want a natural color for their smile, so we can use the click. But I think everybody is a candidate for the click, because it opens some doors for other treatments like restoration, but also like the home bleaching. Unless you have periodontal patients, but you can maintain before the periodontal health and then move on for the aesthetic treatments, or patients that are younger than 18 years old, of course, you're not going to use in this kind of patients. So how to measure the white shades? Always take the initial shade at the beginning. Please, you have to rearrange your Vita scale from darkest to lightest. This is one of the example. I know that this webinar is getting recorded, so we can see it later. But this is the right way. It's easier to explain to the patients where we are, where we can obtain the result, what results we can obtain. And even for us, it's better to explain that we are getting from a P2 to a, for example, from a A2 to a B1, for example, that the patient is going to say, okay, A2, but normally the best one is going to be A1, not B1. So here it's easier to discuss with the patient, and also to get the right shade at the beginning. share the choice. We are here to advise the patient, to suggest options, to support the patient choice. The higher the expectations, the greater the risk. I have a lot of patients that came, want the same smile that Brad Pitt have. I say, okay, that is not natural. That's going to be veneers for this kind of Hollywood smile. But I have a lot of patients that came to the cabinet, to the dental office saying, I want a natural white. I don't want the same thing that the actors have. And for this kind of patient, is a great way to propose the click. Inform about the variability of the results. Make a good assessment in the color so we can predict a little bit more easier the outcome. Explain and sign the informed consent with the patient. Be well prepared on the subject. Know your products. Know how to use them, and discuss this with our other colleagues, for example. And I'm available. You can send me an email or find me in the Instagram and send me your questions with some kind of patient, some kind of treatment, and inform about possible side effects. It doesn't apply too much in the click because honestly we don't have any side effects because for the time being it's good. Maybe I have some questions that people are saying, okay, I'm doing the click, but at the end I rinse with water to remove the product and I have some red stains. The problem in this kind of red stains is because we didn't remove the biofilm as it should. So it was biofilm present, so the product gonna attach himself to the biofilm. Okay, so start with GBT to get a good prophylaxis and remove all the biofilm, and then you can use the click. If you have some red stains, use again the airflow with the plus powder and you can remove it pretty easy. But once again, it shows us that it's not the optimal treatment because if there's red, there was biofilm. So the optimal contact in between the product and the enamel, it wasn't present. So this is a little video of me applying the click. So we have done the GBT prophylaxis. I installed it in the other office because I didn't have the time. I take the right shade, it was a B2. I take always the photo to show the patients the before and after. I mix the products and I can apply it. I applied 2 millimeters layer of the product, no more. We don't need more than that. And I left the patient for 10 minutes. I can just remove the biofilm. You see, there's no red stains at the end. It was a good prophylaxis, so only with water we are removing every product. You take the picture at the end, and we get from a B2 to a B1. It was a really good thing. She was happy. I was happy too. This is one of my patients, maybe one of my best patients, because it was difficult. You can see on the 12 that we have a little restoration interproximal, and we have a cracking on the 21. So in this cracking, it was quite dark. So I was telling the patient, maybe we can lighten up, but I don't know if you can remove it at all. And you know, you have a restoration, maybe you're gonna see a little bit more this restoration because the composite doesn't change the color. So prophylaxis 10 minutes after click, and we had this result. The patient was really happy because you can see the difference and you can see the cracking that's barely visible. Now you're gonna ask me, okay, Celso, but does it last for 6 months? This patient came to me every 6 months. So 6 months after, he came to me with this result. The gums, they are really well because the motivation part was great, and a little bit darker, but also a good color. You can make the comparison with the first photo. It's a good result. The cracking a little bit more in evidence now for the 6 months. And the patient can say also, I want to do the prophylaxis, and I want to do again the 10 minutes whitening. And these kind of patients, they became loyal, and they came every 6 months to do prophylaxis and the click, and you can see 10 minutes after. So, and we have, I've been experienced with my patients that came every 6 months to do the GBT and the click. We experience a domino effect, because you can see the first result that we obtain on the right corner, upper corner, and the lower right corner. You can see that it's whiter that even before, because we get from a lighter shade now. So there's a domino effect that every time that we are doing the click, we are getting better results. So this is really, really fun. We talk about the GBT, talk about the blank one. We saw some cases, clinical cases, but now does this get something more for my clinic? Yeah, we're gonna increase the direct revenue. I started in 2019 with the click in February. 2019, this is only me, one of our clinics. I've done 270 clicks. So this, I'm charging 89 francs every click. So it was increase in direct revenue of 24,000 francs. But the best thing is the patients keep coming, and the patients are referring to another patients. So in 2020, and this is only January and February, because we closed the clinic due to COVID-19. In January and February, only 2 months, I already have done 150 clicks. So it was an average of 58 a month. And in 2 months, I increased 10,000. If this continued like this, I was sure that I'm gonna improve a lot the revenue and in consequence to 2019. So yes, this is gonna be something that you can use as a blank one click as a business model. So we are improving your opportunities of treatment. You are offering something more to the patient, non-invasive, that we can interact with other techniques like GBT. It's a no pain treatment, but you're gonna provide you more referrals, because the patient that you have done one time, you're gonna keep coming back every 6 months to do another click, but you're gonna bring 2 to 3 more new patients. And these patients, it's your job to fidelize them, to keep them in the practice. The other increase in revenue is going to be the indirect revenue. Why? Because we are providing the dentist with more restorations, because the patient wants something more aesthetic. So we're gonna improve the aesthetic with the click. So you're gonna get some more lighter shades, and then he said, I want to change my restoration. So the dentist is gonna start doing more aesthetic treatment too. And even for the periodontal patients, because you say, I don't do any whitening till we have a good periodontal health. So the patient is gonna keep coming for the periodontal treatment. Once you get a good health, periodontal health, we're gonna say, okay, now you are available, you are a good candidate to get a whitening as you wanted at the beginning. Because let's be honest, some of the patients that came with the teeth that they are moving all the time, that we have mobility type 3, type 4, the first thing that they said, I want my teeth to be whiter. And we have to explain, you have periodontal treatment to do now. We can do the whitening once we obtain a good periodontal health. In this kind of patients, is the one that's gonna come every 3 months to do the periodontal treatment. And then at the end, they're gonna say, okay, I want to do the aesthetic treatment. Now we start with the whitening, and then we pass for the dentist. So it's a really good way as a business model. This is the end of my presentation. You have my email, you have my Instagram account too. You can see some good results in my photos in the Instagram. And I'm gonna be available now for questions.
Thank you, Celso. Thank you
you,
for your presentation. Very, very, very interesting. Yes, we have already many questions. Let's start with the first one about the GBT technique. The first question is, what kind of precaution should we take now with the COVID situation?
Okay, with the COVID situation, honestly, we need a little bit more time to disinfect the dental office. That's the first thing. Then the best protection that you can be in personal, you're gonna be FFP2 mask or FFP3 if you can, dental loops, and over the dental loops, the face shield. That is really, really important. And then the goons too. That's the first thing. Then with the GBT, you have to use the high suction aspiration all the time. Use the obtrugate so you can cover the lips, and you're gonna lower the aerosols, because the mouth opener, the obtrugate, it's in silicone, so you're gonna get the aerosols in it, so we have less aerosols off. And then if you use the airflow in the right way, with the good angulation, with the good distance, just get the high suction aspiration in the just right next to it, and we don't have any more aerosols. We're always gonna have aerosols in the dentistry. It's impossible to avoid, but like this you can prevent a lot more. That's the thing.
Thank you. Renee is thoughtful about this technique to be painless. She used Superson, and they told her the same, but
Yeah,
it's a lie. It's really different with GBT EMS system.
the thing is, you have to use the airflow prophylaxis master, because you have a no pain system inside that you're gonna adapt to the material that you are using. If you are using in the enamel, in the calculus, or in the dentin, or in the gums, you're gonna change the vibration. So you need to use the latest machine of the airflow prophylaxis master. The second thing, you need to use the PS insert, because it's the thinner one, so it's easier to adapt and it's less painful. And you have to get the right technique. When you use the ultrasound, don't put any pressure on it. If you put any pressure, the vibration like this, if you put pressure, you're gonna stop the vibration. So we are just getting more contact with the enamel, getting more invasive. So just get soft, let the machine vibrate alone, just get it next to the calculus, and you're gonna remove it. So that's why it's really important to do a SDA training, because there's a practical side that you need to do to learn how to use this machine and how to have a no pain system.
Okay, thank you. Let's move to blank one. Somebody say that tried once, but the patient complained about the heat from the lamp. What can you say about this?
Okay, this is one of the things. You need to get the lamp 5 centimeters in distance of the mouth of the patient. Don't glue the lamp to the teeth of the patient. You need the air to circulate around it. So you need to get, I use 3 fingers because it's like more or less 5 centimeters of distance to put the lamp in the right distance. Till now, I don't have any complaints, just one that said, okay, it's hitting a little bit, but it's just the first till 2 minutes. Honestly, I always say, okay, the first minute you can feel that it is eating, it's just a product that is getting the chemical reactions, but then you don't feel anything else. Some of them at the end say, well, I didn't feel anything. You are a liar, you don't feel anything. Others, yeah, you were right at the beginning, I felt something, but then it was okay.
Yes, I can add that if you do what's also recommended, you don't have any issue. Of course, the lamp is quite powerful because the technology really works with light. But unless you have a very pale skin type, in which case it could be a good idea to maybe screen and use face protection that we supply with the system. Normally there are no issue, especially with CLICK, which is our fast treatment. And this gives me the opportunity to go to the next question from Katie, I guess from Finland or Lithuania, I don't know. She asked, do you ever use blank one touch? In which cases, I would like to explain that blank one touch is the intensive version of CLICK, where you do multiple application of the products in the same session. So
yeah, I have used it. Like I said, I had one of patients that sent me all the family, and then it was a wedding, and for the bride I have done the touch. The touch is the same component as the CLICK, but you're gonna use 3 cycles. I use 3 cycles of 8 minutes, 3 to 4 cycles of 8 minutes. I use in some cases that people want something more aesthetical, because the CLICK, we're gonna get 2 to 3 shades lighter. With the touch, you're gonna have 5 to 6 shades lighter. But with the CLICK, I can use right away after the dental hygiene appointment. With the touch, I need more time. Normally, like I said, 3 to 4 cycles of 8 minutes. So I need to ask them to come another day. And also I do all the time X-rays and check up with the dentist before using the touch, because you're gonna spend more time in the mouth of the patient. So I want to avoid some problems, like if you have a cavity interproximal that I haven't seen it, and yeah, just in that case. But when the patient asks for more aesthetical treatments.
Okay. Anna Souza, say hello, Chelsea. Maybe you know her.
Hi, Anna. I know Anna. She was
And,
one of my colleagues in the university.
oh,
Hi, Anna. Yeah, normally I propose the home kit is for people with the enamel that is harder to bleach. That's why I'm using the home kit. If I can use the week before after the CLICK, I have done it. Yeah, I have done it. It works, but for the harder cases like C and D shades, I always do CLICK plus the home version, because you're gonna stay longer in contact with the mouth of the patient, in the teeth of the patient. So you're gonna get a more durable and better results. With the CLICK, every time that I'm using, I'm getting 2 to 3 shades lighter. One of the cases that I use the home bleaching, like you said, I had 1 shade lighter. So in this case, it's not the best solution, because the patient wants 3 to 4 shades lighter. So that's why I'm using the home kit with this kind of patients.
yes, as the question was about the combination treatments with CLICK and home trace products. One question from my side. In your experience, if you do CLICK before doing a home treatment, can you expect to have a shorter home treatments instead of the usual 2 weeks treatment?
Yeah, that's the thing. With my patients, the home treating lasts 1 week only, because we already start the whitening process with the CLICK. So we got 2 to 3 shades lighter. Then we're gonna go with the home kit, and instead of doing 2 weeks, we are doing 1 week. So I send the patient with the trays and the products. 1 week after, he came just to see if it's the result that we wanted to have. If not, we can prolong a little bit more, 2-3 days more. But yeah, we can reduce the time from 2 weeks to 1 week if we do CLICK plus home bleaching.
Okay, we have a couple of questions about toothpaste and the pen as a maintenance program to be used at home. What kind of toothpaste do you recommend to support the treatments at home? And also, if you recommend the pen, we have Rene who had some sensitivity with the pen, and less efficient, I don't know, compared to what.
Yeah.
What's your experience with this?
The pen I use for 5 patients because you know, sometimes I don't trust my patients. That's a little bit harsh to say, but the patients that they are really addicted to bleaching, I don't provide the pen. But for the ones that use it, I'm saying to use it once every 3 days just to maintain the whitening. Okay, it's not the pen that's gonna white the teeth, it's just to maintain the whitening that we already have done. And the toothpaste, to maintain the whitening, I'm using the Blank One toothpaste, honestly. It's effective, and I'm getting good results. But the most important, like I said, is the good home care that patient have at home. If you have a good oral hygiene, you're gonna keep the whitening for a long time. If he's a smoker, of course, it's not gonna get the whitening for more than 3 months. But for the smokers, Blank One have a really excellent product that I use a lot with the smokers. That after the whitening, I use the varnish. The varnish is a layer that you put in the enamel that's gonna protect just the enamel from all colorations. And I get a really good result with this varnish. This is one of, Andrea, this is really one of the products that I really enjoy from Blank One, is this varnish for the smokers. It helped me a lot.
Excellent. Just for the people, the varnish name is Blank One Seal. The pen is a Blank One Stick, and the toothpaste is a kit which is called Blank One Duetto, which is made of 2 different types of toothpaste to be used in an alternative way, maybe one in the morning, the other in the evening, because one is more whitening and the other is more dedicated to the care of the smiling gums. Okay, another question. I've been used Click for quite a few times. Some patient feedback are the shade relapse quite soon. What advices can you give for those cases?
Just 2 advices. One, check the motivation and the home care of your patient. And second one, if you're seeing this a lot, maybe the prophylaxis isn't at its best. Maybe we are getting some biofilm. And I can add a third one with the varnish. You can use the varnish to keep the treatment as long as we can. But be careful with smokers and drinkers of coffee, drinkers of soda. These things can reduce the time of the whitening. And for example, I have the experience with the Italians that really love spaghetti with tomato sauce, and tomato sauce is one of the things that gets some colorations. So yeah, be careful with these kind of things. If you know that the patients are using it, do the varnish, and we can keep the treatment for a long time.
Okay, thank you. Carla Pinto asked, do you click every 6 months for all your patients?
The patients, they already have done it, they ask me to do it. So for someone that already are a B1, I'm gonna say no, we can do it next time, and they're gonna follow my advice. But the people that came every 6 months and they want to do it, and I can see that we can get better results, yeah, we can do it. It's a non-abrasive treatment. Let's be honest, if you're doing a click, it's the same thing that's getting a can of Coca-Cola. It's the same effect that you have in the enamel. One can of Coca-Cola is the same thing that using one click. So it's nothing, honestly.
And another question from Roxana: how often can we do the clicks? If a patient is motivated and he wants to repeat on a regular basis, what's your suggestion?
Yeah. Normally, I say every 6 months. That's the best solution. Some cases I had 2, 3 that we have done with 1 week apart because they wanted a little bit more to whitening, but every 6 months. Yeah, and like that, you can correlate with the prophylaxis. People are coming to do the prophylaxis, and then you are doing the whitening. And like this, you're gonna get the best result as possible because you have done the best prophylaxis in the world. There's no biofilm, and you're gonna get the click in the optimal contact with the enamel.
Yes, I add to this that basically click is a very light treatments that can be performed also on a regular basis. In Italy, we have people that likes to repeat maybe even every 3 months. There is no problem if the patient is motivated and they want in between one hygiene section and the other to repeat click. Is there no problem? The point is you have to evaluate if it's really necessary, depending on the habits, on the tooth structure or whatever. If you can't offer GBT, for example, I don't have the AMS machine, will be difficult to use blank one products. For example, after hand instrumentation and prophy paste brushing, it's not good to use blank one.
You can use it. The point is, it's different to obtain the best results that you want. The best way to get these results is getting the most minimal invasive and most efficient prophylaxis, and that is provided by the airflow. So you can use it, but it's going to be a little bit harder. And you saw the image with the prophy paste that stay in the depressions of the enamel. It's going to be a little bit, you're going to get results, but not the ones that I got in my image.
Yeah, one of the very interesting things that we understood today is that prophylaxis works synergistically to prepare the tooth surface for teeth whitening in a perfect way, because of course you know that teeth whitening means that some active principle, oxygen, penetrates the enamel to do the whitening job. And if the enamel is not perfectly prepared to receive the oxygen, this will hinder and limit the efficacy of the result and also the duration of the results, isn't it?
Yeah.
Okay. A question about the lamp, Raquel Silva. Do you have better result with blank one lamp? What with other type of lamp, or I guess curing lamps can be used? What's your opinion?
The thing is, you need a lamp with the same length wave that the photosynthesizers have. So the Arcos lamp is the blank one lamp is the best one because they have the length wave from in between 430 and 490. If you are using a zoom lamp, it's not in between this interval. And the thing is, with the zoom lamp, you need to get the attachments for patient for treatment.
Yeah.
So yeah, to better results, again, use the Arcos lamp. It's the one with the perfect wavelength of for the photosynthesizers.
Yes, I can add to this that the system has been designed and developed using the Arcus lamp, which is the system lamp, and this type of lamp is quite powerful. And the system really needs energy from the photons to activate and to breaks down the peroxide in such efficient and fast way. So yes, you can use other lamps. Most lamps will work. Probably you will need to increase time, and probably you will not get the same result. Curing lamp can be an option, but not a very good one. You will not get what you should expect from the treatments with this type of lamps. Another question: do you use a specific consent for blank one? There is an informed consent on the blank one website, which is blankone.eu/pro, which is the professional area. You can download here. But
Julian, if you want, I can send you my consent too. My consent. I
Okay,
know.
you have the email, you can write also.
Yeah.
Okay. Dental hygienist students from many more questions coming in from Spain. He's wondering if he can job by himself as a consulting with just GBT and Blank One in Spain. Is this a good business model? Or I think as a consulting, so is working for different clinics or I don't know.
This is hard. Okay, I'm been using this for a quite for a while. GBT I'm using for some years, and I established a GBT business model in our clinics with really good results. And then we had the click because we saw the potential, and it's really one technique that we can add because it's non-invasive with GBT. After, if you are working as a consulting for the clinics but you don't use GBT plus click, it's kind of the wrong message. You need to use it, and once you use it and you develop the concept, yeah, you can do it, but with the right partnership. You have to be the consentment of a GBT, of a EMS, and the consentment from Blank One too. Yeah, if you are already using and getting results, and you are sure that you're not gonna lie to the clinics, yeah, go ahead. You can develop something in there. If you are not using, first spend a year using it, see the results, see the benefits for the patients, see the benefits for the clinics, and then you can develop something.
Okay, thank you. Kunta is asking, can I use it one day after the cleaning?
Yes, it happens for me sometimes when I don't have open space in another dental chair, but the patient wants to do it because he's gonna leave in the weekend for somewhere. So what I do the GBT one day, and the next day the patient can. I've got just the airflow and do the click. So I'm gonna spend 20 minutes with the patients if we do the next day. This is something that we can juggle with. The best thing is to do right after the appointment, because is the best way to get the best results. If you cannot do it, yeah, we can do it one day after, no problem. If you have some free time in your planning. Honestly, for me it's quite hard. Normally I take these patients after my schedule because I'm always full, but yeah, you can do it. But don't forget, do the airflow just to remove a little bit of the biofilm that starts forming already.
Okay, I put together two questions about the varnish, the Blank One seal. How long stay the varnish? And if there are any other suggestion you can give for smokers?
Yeah, for smokers, the best thing is the motivation of oral hygiene, motivation to stop smoking or diminish. And the third thing is the varnish. The varnish we're gonna apply 3 times in the mouth. So you apply it, you let it dry, then you apply it again. It's gonna take maybe 15 minutes. And then for 2 hours, the patient cannot eat, cannot drink. After that, I think the varnish normally with my patients, you're gonna last for 3 to 6 months. It depends of the patient too. If you are doing with a sonic or electric toothbrush, because it is a little bit more abrasive, or doing with a toothpaste that is more abrasive than the sensitive ones, it all depends. But because you need to have some abrasion to remove the varnish, of course.
Okay. Do you advertise and promote Blank One separately from GBT or as a complete package to your patients?
Honestly, with a complete package, because patients are coming to me to do the prophylaxis, and then it's something that I can add to prophylaxis. So we have in the waiting room the two things separate, saying, okay, we are doing prophylaxis with GBT, and we show in the screen how we are doing, and we have flyers too. And we announced that there's available a blank one. There is a whitening system, 10 minutes, no pain, no sensitivity, less invasive, and we have flyers too. But when the patients come and ask to do the whitening for 10 minutes, we always say, okay, we need to do the prophylaxis before doing the whitening. Because let's be honest, if you have calculus or you have biofilm, the results is not the same. And it's my image, it's my brand, but also the image and the brand of our dental group. We want to provide the best quality of treatment, and the best quality is to associate the two.
Excellent. Best advice to manage patient with sensitivity after blunt one-click treatments. Do you have sensitivity?
I never had sensitivity with blank one clicks. Honestly, if you have it, I think it's the universal system. Do some fluor after the whitening. I do it every time after whitening. Provide sensitive toothpaste, and have a varnish of fluor once a week at home. But to be honestly, I never had any sensitivity due to the blank one click. So it's an unknown terrain for me.
Yeah. Should the gum be totally healthy for using click?
Yeah, or at least no bleeding. At least no bleeding. But the best thing is having a good periodontal health. Yes.
Okay, and no need, this is another question, no need for isolation for gum protection.
No need to any kind of gum protection. The only thing that I am using is the Optrogate or a mouth opener to keep the mouth of the patient open during the 10 minutes.
Okay. This procedure can be used on orthodontic patients?
To get the best results is to do the click after the orthodontist. You can do the GBT in the orthodontic patients, in Invisalign, brackets, you name it. But to the whitening, of course, you need to remove all the attachments for the Invisalign, all the brackets, to get the most of teeth surface in contact with the product. So yeah, no, after the treatment, after the orthodontic treatment, I have a lot. The orthodontist finish the treatment, send me to do the prophylaxis, and then we do the whitening too. And otherwise, no, during the treatment, I say no. After, of course, you can do it.
Okay. Do you recommend a what diet after click? If so, for how long?
I recommend for the day, a white diet for the day. Then the patient can do the normal diet that they are used to. Like I'm not gonna prohibit the patient to live a normal life. I'm just gonna say in the consent that are food like coffee, tomato sauce, things like that, that's gonna reduce the whitening effect and the duration of the effect. But then 24 hours after the click, I always say, okay, avoid food with a lot of colorants, white diet, like you said, and just to maintain and to stabilize the whitening. And then yeah, you can do the life as normal. Of course, for a smoker, I'm always going to motivate to stop smoking. For people that are drinking 1 liter of Coca-Cola every day, I'm gonna advise them to stop. But yeah, we need good things. I love chocolate sometimes, so I eat chocolate as a dental hygienist. Just not exaggerate, and yeah, brush your teeth after.
Okay. What if after airflow you have bleeding? This is often the situation, especially if patient have gum inflammation.
Yeah. Normally, when you use the airflow is in the beginning, then we're gonna do the ultrasounds, then we're gonna check. So it's the time to stop we are leaving time to stop the bleeding. If it doesn't stop, yeah, we can arrange to do another day. But if it stops, yeah, we can do it. Just pass some water, some air to blow dry the teeth, and if there's no bleeding, yeah, you can do it. Otherwise, if it's constantly bleeding, of course, the best thing to do is to avoid doing the same day and schedule 1-2 weeks after.
Okay. What about the white spots? $1 million question.
Yeah, that is quite hard. It's unpredictable with our white spots. Sometimes we got to completely camouflage them with the rest of the enamel. Other times they are a little bit more whiter, but it's gonna last 1 day. After that, with the saliva and everything, the experience that I have with my patients, they gonna disappear. But if we have really big white spots, normally I do the product around them and not directly in the white spots, just to camouflage at the end of the treatment. And until now, I had really good results. So I think I'm gonna keep doing it. But it's always the most important thing: communicate with the patient, explain the unpredictable results and the presence of white spots that can be a little bit more whiter for a while after the whitening.
Yeah.
And just advise the patient, and the patient gonna take the choice.
Okay, one question from our Asian friends. Do you use Ultra? Ultra is high concentration products in Blancon range, and on what type of patients?
Yeah, I don't use Ultra. Just for, I think I want to keep the minimal invasive treatment as possible. And that's why I'm using only till 16% of carbamide peroxide. That is the equivalent to 5 to 6 hydrogen peroxide. So I'm not using Ultra. That's why I want to follow the rules like you saw in the video at the beginning, the European rules, the saying till 16% is good. And I want to keep our treatment the less invasive as possible. I'm getting good results with the Click and the Ultra and the home bleaching. So yeah, I'm not.
Touch and home bleaching. Yes, is there, especially in some countries in Europe, still a tendency to use high concentration of power bleaching in office? I was impressed when we first met about your point about this type of treatments and the fact that they are still allowed to be in the market in Europe. I'm talking as a medical treatments. And you were telling me the story about the fact that to justify the use of a medical whitening, you should find a claim for some psychological issue, but it's very difficult to
That's it. It's different. Here in the law is saying, okay, more than 16% is a medical device, so we have to give them the reason why we want to use more than that. And we have to claim psychological reasons that's going to help patients. And that's why there's the World Health Organization saying that a good health is mental and physical. So we're gonna go to the mental, saying, okay, this is gonna provide more positivity in the life of this patient, but it's really hard to justify it. And for me, I want to keep this the less invasive as possible. That's why I'm using GBT. That's why I'm using the blank one, click and touch and home bleaching. Otherwise, I don't see any point at all.
Yeah. So if you have to deal with difficult cases, you prefer to use combination with maybe click and home. Okay. How do you deal with non-vital teeth?
Yeah, most of the time we are doing the internal bleaching in the non-vital teeth, and then we can do the whitening for the other teeth. Normally I start with the click. If I get a good result with the click and we don't see any difference, spot on, really good. If we still have some difference, I do home whitening, because we can control a little bit better. Every day we can see the difference till the day that we don't see any difference at all. So that's what we are doing for the non-vital internal bleaching, and then we start click and home bleaching if we need it to get the same color in the same in the every teeth.
One last question. We have seen tape ID brush in slides. Do you like this? Do you recommend this?
I really like TP.
But...
I really like TP. I like also Curaprox, but honestly, for the periodontal patients, I'm always advising TP because they are a really good range of sizes. They have the colors, the bristles. They are really good, and they don't break these interdental brushes. So, and we can play around getting some bending to get for on the less more difficult molars, for example, to achieve. But yeah, I really like TP. I am getting good results with periodontal patients, so that's why I'm still using it.
Okay. Thank you, Chelsea. We have replied to all the questions. Thank you for your time and for being with us today.
Thank you for the invitation.
I think it's been a very useful webinar, and we hope to be able to repeat it, to improve, maybe to add new topics in future.
Yep. Thank you so much for the invitation. Thank to all the participants. If you have any questions, you have my email address, you have my Instagram account, and I'm sure with Andrea we're gonna talk with some more topics, and maybe do another one in the future. So thank you all. Thank you for the support, Paulo, too, and have a nice day.
Thank you.
And stay safe. Bye.
Thank you. Thank you, everybody. Have a nice day and stay safe at home. Ciao.
Bye-bye.
Bye.